Hello.
Hello.
Hi, how are you?
Good, how are you?
Good. My name is Najma. I'll be your student nurse today. Can you please state your first name, last name, and date of birth, please?
My name is Allie. I'm 40 years old and I was born on April 24th, 1985.
Sounds good. Allie, today I'll be assessing your kidney, your bladder, and urinary system. I'll be asking you a couple of questions. Is that okay with you?
Yes, that sounds good.
Okay, before I do anything, I'm just gonna go ahead and put the bed up a little bit. Okay, Abby, I'll ask you a couple of questions about your kidneys, bladder, and health history overall. I'll also educate you on labs that were ordered for you today, later on. Is that okay?
Yes, that sounds good. I was curious about what those labs were for.
Okay, I'll educate you later on. Now I'll ask you a couple of questions based on your medical history. Have you had any UTIs recently?
I had a UTI 2 years ago and I try to take measures to prevent another one.
Okay. Do you have a personal or family history of kidney problems such as renal disease?
Not that I know of.
Okay. Do you have or have you had any Foley catheter in place?
Nope, not recently.
Okay, now I'll ask you about your urination patterns. Do you have any problems with passing urine?
Not at all.
Are you experiencing urgency with having to urinate?
No urgency.
Okay. How often do you empty your bladder?
I go to the bathroom at least 5 times a day.
Okay. Do you get up in the middle of the night to go to the bathroom?
Not usually.
Okay. Are you having any pain in the upper portion of your pubic area or in the lower back?
No.
Okay. Are you urinating more frequently than usual?
No.
Okay. Do you have any pain with urination?
No pain.
Okay. If I may ask, what color is your urine? Is it dark yellow? Is it amber color, like light yellow?
It's usually a light color.
Is that clear or cloudy?
Usually clear.
Okay. Have you noticed any foul odor when you urinate?
No, just the normal amount of odor.
Okay. Have you had any difficulty in starting your stream?
No.
Okay. Have you noticed any changes in the pressure of your urination?
No.
Okay. Have you had any dribbling of urine when you urinate?
No.
Okay. Have you had any problems with leaking urine when you cough or laugh?
No.
Okay. Have you had any problems with emptying your bladder completely?
No.
Okay. Do you have any discharges from your genitals?
No.
Have you had any recent weight gain, ankle swelling, or shortness of breathing?
No.
Okay. Well, your doctor ordered you few labs, and I'll just tell you what those check for. First, the BUN, which is blood urea nitrogen, is a laboratory value that measures the amount of urea in the bloodstream. It basically checks for your renal function. And then the second lab that was ordered for you was the creatinine, which checks for your renal function as well, and is the best indicator of any dysfunctions. I'm just gonna go ahead and document that. My partner will come in a minute. If you have any questions, please let me know.
Okay, thank you so much.
Okay, come on in.
Hello.
Hello.
My name is Ellie. I'm a student nurse.
Hi, Ellie. My name is Allie.
Can you verify your name and date of birth, please?
My name is Allie. I was born on April 24, 1985.
Okay. Thank you. I will be doing the physical assessment portion of your urinary and renal assessment. And I am going to put the bed up. Is it okay if I put your head up?
Yes, it's fine.
first I'm going to check your mucous membranes on your eyes, your nose, and your mouth to check for hydration. And I'm going to look at your arms and the skin turgor. Okay, everything looks good. Okay, and I'm going to lay you back a little bit.
Okay.
Okay, I'm looking for distension or anything that looks abnormal, and everything looks good. And I will palpate your bladder, so I'm just going to touch your bladder a little bit and let me know if you feel any pain.
No pain.
Okay. Kidneys are not usually palpated, but in cases where there's noticeable distension or edema, we would palpate the kidneys. And in order to do that, you would reach one hand under the patient and one hand on top and press and feel the kidney. Do you feel any pain when I palpated your kidneys?
No.
Okay.
So what we're going to do is we're going to take our hand and we're just going to put it over here. We're going to make a fist and we're going to thump our hand. And we're going to ask the patient if they have any pain. Okay, do you have any pain with that?
No.
Nope. Okay, and then we're going to do it to the other side. Do you have any pain?
No.
I'm going to cover you back up now. Okay, I'm going to lower your bed. And I'm done with the physical assessment. Do you have any questions?
No. Thank you.
You're welcome.
All right.